All right, I'm gonna do a little demo for you guys on diaper changing. So this is the baby I'm using, and they have a belly button, but just remember, if you're in that first 7 to 10 day window and the cord hasn't fallen off yet, you just wanna always make sure that you fold the diaper below the cord. That way it will be able to dry and fall off appropriately. It's just like a scab, so you just want to leave it open to air. It's fine for the baby to wear clothes, but just make sure the clothes are loose fitting and not super tight. That will help with the healing process. And as the cord dries and heals and falls off, you just want to monitor for signs of infection. So that might be redness or swelling or any kind of drainage or foul smell. There might be teeny tiny amounts of bleeding, but if it's more than that, definitely let your provider know. Okay, so let's say we are going to check if our diaper is soiled. I recommend always checking prior to feeds, and then oftentimes babies will go during a feed. So if you know that they have gone, definitely change them. The more clean you can keep them, the less you're gonna have to deal with things like diaper rash. So there's usually an indicator for urine on diapers these days. It's a yellow stripe. So if you are checking the diaper, just look at that stripe. And if you notice that it's turned green or blue, then there's urine there. And then to check for poop, you're just going to take a peek down the side like that and make sure that you look all over and make sure that that looks clean too. But if you find a soiled diaper, I'm going to show you guys some tips and tricks on how to change the diaper. So I always recommend taking the clean diaper and putting it underneath the baby like this. That's going to serve as a nice barrier between the baby and whatever linen you have here, because I don't know what it is and it's not studied, but when babies get naked, they just like to go. So if they go, once you remove this soiled diaper, it's going to go all over their bed or whatever changing table you're using. So this is going to be a really nice barrier to shield your linen from that and save you a couple loads of laundry. So, all right, so let's get to changing. We're going to open up that soiled diaper and you're going to use your wipes. And if you have a girl baby, remember to always wipe front to back. That's going to help decrease UTIs or urinary tract infections. And make sure that you get all of the stool off their skin and clean them up really well. You're going to keep all your soiled things in a big bundle here and then roll it all up, and got your soiled stuff here. So now if you were just getting rid of that and your baby peed, if it's a girl baby, it's probably going to go right onto this diaper you put. If it's a boy baby, it might come up like a fountain, which is pretty funny the first time, but then it's probably not that funny. So this is your little shield that's ready to go to cover up a boy if they start peeing. Okay, so it just gives you a quick action that you can block that from going everywhere. Okay, so now when you put on that new diaper, if you do have a boy baby, I recommend that you take your finger and just gently point his little thing down. If it's pointed up and you put the diaper on, I don't know how they do it, but somehow the pee can come right out of the diaper and go onto their body and face. So make sure you point that little thing down. And then again, fold over that top layer if you're still in that first 7 to 10 day window where the cord is healing. And then you're going to put your little side Velcros on. And now you have a very clean and happy baby.